Hello learners, today's chapter is Cardiovascular System. We all are familiar to heart. Heart has four chambers: right atrium, right ventricle, left ventricle. The right atrium receives the blood from the body through the two large veins. One is superior and other is inferior vena cava. It empties blood into another chamber of the heart, the right ventricle. The right ventricle pumps the deoxygenated blood to the lungs through the pulmonary artery. Inside the right ventricle, which pumps blood into the pulmonary trunk and divides it into right and left pulmonary arteries. A semilunar valve called pulmonary valve, which prevents the flows of blood back into the right ventricle. Guard opening of the right ventricle into the pulmonary trunk. Blood from the pulmonary trunk enters to the pulmonary circulation and receiving oxygen from the lungs. The oxygenated blood flows through the pulmonary veins to the left atrium. From the left atrium, the oxygenated blood enters to the left ventricle. The left ventricle in the main pump chamber, sending the blood through the aorta and over all of the body except lungs. There is a valve at the junction of right atrium and right ventricle, that is called tricuspid valve. Ensures that one way flow. It prevents the blood flow flowing back from the right ventricle through right atrium. Similarly, there is a valve called bicuspid valve, or mitral valve. It is presented on the junction of left atrium and the left ventricle. Blood circulation within the chambers of the heart. The left ventricle pumps blood into the aorta. The aorta supplies the blood rich in oxygen and nutrients to the entire body system. The branches of aorta are the arteries, and those are called systemic arteries, since the systemic arterial network is much more extensive than the pulmonary artery network. The left ventricle has to pump blood at the much higher pressure than the right ventricle. It is made possible by the much thicker wall than that of the right ventricle. The blood vessels of heart, aorta, arteries, arterioles and capillaries, and last is veins. Pacemaker and conduction tissues. Heart has a well developed pacemaker tissue, which can generate rhythmic impulse. As the name suggests, the tissues say the pace at which the heart beats, that is AV node, SA node and bundle of His. Pacemaker of heart is SA node, sinoarterial node, a section of nodal tissue which is situated in the right atrium near the opening of superior vena cava. This is the node from where the electrical impulses originated. Functions are to set the rate of contraction of the heart and spontaneously generate nerve impulses. The other pacemaker tissue is AV node, which lies in between the atrium and ventricle, situated in the right side. AV node controls the transmission of the electrical impulses from the artery to ventricles. The next is bundle of His. It is a bundle of heart tissues which is transmitted the electrical impulses from the AV node to the ventricle, causing the cardiac muscles, which is ventricles, to contract. The bundle of His divides into the network of Purkinje fibers. Those are not fibers but are actually modified strands of cardiac muscles. Next topic is cardiac muscle. It is not under voluntary control unless the muscle is a branched one. In the microscopic situation, the muscle shown as cross straight line. The uniqueness of the heart. Properties of beating heart. Automaticity, rhythmicity, long refractory period, extrasystolic or compensatory pause. The natural impulses is inactivated and a normal expected construction when it is missed. As they say, I missed a beat. The pause of cardiac activity is called compensatory pause. The next is cardiac output. Cardiac output is expressed. The output is of the heart per minute. We already know that the function of heart is pump blood. Hence, the cardiac function is best expressed quantitative terms as the amount of blood pumped by each ventricle per minute. The amount of the blood pumped by other ventricle during every beat, called stroke volume, is about 70 ml at rest, and heart beats about 70 times per minute at rest. Hence, the cardiac output is expressed as under cardiac output equal to stroke volume into heart rate, 70 ml into 70 per minute. The cardiac output per unit body surface area is relative to constant from the individual to another. It is called cardiac index. Expressed is as under cardiac index equal to cardiac output by body surface. So, the cardiac output equal to stroke volume into heart rate, and the cardiac index is cardiac output divided by body surface area. Cardiac output varies in a day-to-day situations. One everyday example of such a situation is exercise, which is associated with an increase of blood flow to the working muscles, legs, hands and heart. Next topic is cardiac cycle. Cardiac cycle has two phases, one is diastole and two is systole. Diastole is ventricles are relaxed and systole is ventricles are contract. In diastolic phase, the deoxygenated blood from the superior and inferior vena cava flows into the right atrium. The opening of arterioventricular valve allow the blood to pass through the ventricles. The nodes contracts and triggering the artery to contact. The systolic phase, during the phase, the right ventricle receives the impulses from the Purkinje fiber and contracts. The arterioventricular valves close and the semilunar valves open. The left ventricle receives the impulses from the Purkinje fibers and contract oxygenated blood to the pump into the aorta. The aortic valve prevents the O2 blood from the flowing back to the left ventricle. The aorta branches out to the provide oxygenated blood to the every parts of the body. The oxygenated blood is returned to the heart via the vena cava. The heartbeat flows in the regular recurring method. The one contraction which is systole following by the relaxation which is called diastole. The whole cycle is known as cardiac cycle. Heart sound. There is some sound like lub and dub. What are those? Lub is the closing of arterioventricular valves, while dub is the closing of pulmonary aortic valves. We know now that the heart is placed toward the left like a pyramid. Thus the sounds are produced. Next topic is blood pressure. It refers to arterial blood pressure. Hence, it is the lateral pressure exerted by the column of blood on the walls of the arteries. The pressure is not steady, it fluctuates during the cardiac cycle. During ventricular systole, arterial blood pressure is higher than the during diastole. The normal range of systolic blood pressure is 100 to 140 mmHg, and the diastolic is 60 to 90 mm of Hg. Mean blood pressure. Mean blood pressure is not the arithmetic mean or average of systolic and diastolic blood pressure. This is because of systole is much shorter than diastole. Therefore, accurate pressure is the near of diastolic pressure for a longer part of cardiac cycle. That is the differ from the systolic pressure. A mathematically pressure method for finding the true mean pressure is when 1/3 of pulse pressure is added to the diastolic pressure, we get the value of mean pressure determined by the graphical method. How to record the blood pressure? Blood pressure is recorded as two numbers. One is systolic number and in the under systolic number and the under of the diastolic number, like 120 divided by 80. It is the normal blood pressure. Factors affecting cardiac output. Increase cardiac output when the blood volume is increases, cardiac output is increases during exercise, and increase of heart rate, emotional excitement increases the systolic and diastolic pressures. Decrease of cardiac output is changes of posture, reduction of blood volume, cardiac compression, myocardial ischemia or infarction, trauma, etc. Next is hypertension. Classification of hypertension is the most cases the hypertension, the cause is only known in the term of old familial tendency, emotional stress, sedentary life, overeating, etc. In the cases, those basic causes of hypertension cannot be pinpointed. That hypertension is said to be primary hypertension. Few cases where underlying cause is known, that is called secondary hypertension. Common causes of secondary hypertension in renal disease, Crohn's disease, long-term oral contraceptive pills, increasing viscosity of the blood, tumoral problem, etc. Myocardial infarction and myocardial ischemia. A patient experiences a heart attack suffers from the severe pains on the left side of chest and radiates to the left arm. He may sweat a lot, vomit, may not able to take food because of the pain. The cause of heart attack is eating faulty diet, and old saying, your mind and body is what you eat. A person over the years may eat fatty diets like butter, meat, eggs rich in cholesterol. These may accumulate the coronary vessels and obstruct it. It leads to myocardial ischemia. If myocardial ischemia is very severe or a coronary artery is blocked due to atherosclerosis, it causes death of the myocardium supplied by the blocked arteries. This is called myocardial infarction. Next, what is atherosclerosis? Atherosclerosis, the hardening of the walls of the arteries caused by fatty deposits. that build on the inner walls of arteries which interfere with blood flow. Insufficient blood flow of the heart muscles from narrowing the coronary artery. It can cause a chest pain too, that is referred as angina pectoris. How to keep your heart healthy? Supplementing exercise and balanced diet is must. Salt needed to be restricted in the hypertensive patient, like lots of fruits, green vegetables, milks and cereals contents with your healthy nutritious diet. What is ECG? ECG or electrocardiogram. It is an electrical recording of the heart made by the electrodes picking up cardiac activity from the human body surface. We must learn about some points of which is diagnosed by the ECG. Those are sinus bradycardia, sinus trachycardia, sinus erythrolemia, ventricular fibrillation, etc.